Reverse translational is a way that we're beginning to address one of the big challenges in cancer research, which is about giving the right drugs to the right patients at the right time and in the right way. That's really what personalised medicines is about. In order to understand how we do that, we really need to look at samples from patients, be it blood or be it tumour. Potentially that is going to be much more informative than experimental models. So the last 10 years there's been a lot of translational work, taking things from the lab into the clinic, but now increasingly we're trying to do reverse translational, which is go from the clinic back into the lab. Clinical staff working in a busy NHS environment have to inform patients about the importance of research. And then really key and very important is the engagement of patients, and patients being willing to consent to giving a cupful of blood or for allowing some of their tumour to be used for research purposes.
In the area of lung cancer, some years ago, some investigators made an observation that a particular growth factor was elevated in the blood of those patients. This growth factor was called fibroblast growth factor 2, or basic FGF. We took that observation, went back into the laboratory and asked, well, what is this growth factor doing to lung cancer cells? Now, we know that the reason why patients die of their cancers, and lung cancer in particular, is because the disease is resistant or becomes resistant to the existing therapies. But we didn't really understand what the mechanism of the resistance is. In practice, it turns out that there are many mechanisms, but one of those mechanisms turns out to be related to this growth factor. And if it's elevated in the blood of the patients, then the tumours don't respond very well to the treatments that we give. So knowing that means that we could develop a drug that blocks the action of this growth factor.
When a patient donates a sample for research, it goes first of all to the tissue bank, where we register the patient's consent, and we can then use that material for various research projects. There's no actual time limit to the amount of time that we store. Actually, in some respects, the longer we store them, the more valuable they become, because the more data we can collect on what has happened to the patient, what treatments have they responded to those treatments or not. And when we're devising new treatments, it's often the patients who don't respond well to the normal therapies are the ones that are most valuable, because they're the ones who are likely to suffer further problems with their disease, and they're the ones that we need to be treating in the future. If the patient at any time decides that they want to withdraw their consent, we can destroy all the existing samples that have not already been used. So it's very important that we stick to all the legal guidelines in this country.
Those of us who are doing cancer research clearly want to try and benefit patients, to improve patient survival. But it's also about trying to have more rational approaches to how we do chemotherapy. And especially with some of the newer, more targeted agents coming through, clearly we want to use those in the best way. And so by understanding the disease, by understanding how the drugs work in the disease, and by understanding how they work in patients and reverse translating that back into the laboratory, that gives us a lot of increased understanding of the disease.
Patients are absolutely essential for us to be able to develop new treatments and ways of stratifying patients to those therapies which will most benefit them.